new mobile and outpatient ultrasound services, they're actually designed for the stable patient that the general practitioner may need just a little bit of help or a little bit of reassurance about the disease process that may be going on, rather than a full referral. And us doing either mobile or outpatient ultrasound just kind of helps provide that little bit of support for them, and also the confidence to continue the therapy as far as what needed for the pet.
I want the very best for the pet. And I know that if I can't do it, that Upstate Veterinary Specialists is where I'm going to send them.
One of the biggest things that I try to do when I do ultrasounds is not only going through and describing what you're seeing, but then interpreting those findings, because that's more important than actually what you're seeing, because anybody can tell you, I see a kidney, but what is that kidney? What does that appearance mean in terms of what the animal's presenting for, lab work changes? It's the big picture, because their clients are paying for a test and they're using it to help make a diagnosis and to help manage, and so we need as a team to figure out how important that is and what we've gotten from it so they can make decisions.
So during an outpatient ultrasound, generally what will happen is an owner will bring their pet to Upstate Vet. At that point, their pet will be taken back and the ultrasound will be performed. Generally, it'll take about 45 minutes for the ultrasound study to be complete. Once it's finished up, we'll actually do a written report that we will fax or email to their vet at that time, and we will actually call their veterinarian on the phone to discuss those findings at the time. And that way, as their pet's leaving the hospital, their vet is already being updated on what the findings are, and a plan is being developed for that long-term care.
And I think there's a confidence that they can give their owners that not only are they getting just the diagnostic test, but some of the interpretation that is so key to ultrasound. It's not just ultrasound, it's taking it to the next level of what does that mean.
When you send your patient there, they're receiving a service that you can't provide. It's still your patient, and it's going to come back to you, and you know it's going to come back, and the client is going to be happy.